We handle all bread and butter surgery cases, from simple things like gallbladder surgery and hernia repairs to complex abdominal hernias, breast cancers. We perform colectomies for colon cancer and colon and digestive diseases. We manage emergency cases that come in through our ER, whether it's something as terrible as a gunshot or stab wound, all the way down to simple infections. We handle chronic care of complex wounds, whether that be from venous stasis ulcers, diabetic ulcers, and pressure wounds, even mild cosmetic procedures such as scar revisions in conjunction with other colleagues to facilitate complex surgical repairs. We're located right across from the hospital on Alice Street. It was designed from the ground up to be all-encompassing with fast central hub of nurses and at least 2 physicians on either side that could, attend to their row of patients. So you come in through the front office like every other medical office, and we bring you back in so you don't have to wait very long. We really pride ourselves on efficiency. Of course, every office can slow down, but we don't want to keep people waiting. We know that there's lives to get back to, and there's questions that you want to have answered, so we want to get to it as soon as you can. We provide longitudinal care. From the very first person that you see in the office, which will be us, all the way to the very last follow-up, it's still going to be the same physicians. So in that sense, we're going to take care of you at every single step of the process. We won't replace ourselves with a colleague. You won't have another physician step in. If anything, we network with other physicians, so we create an actual team of specialists instead of just focusing on one doctor or one interchangeable doctor. In terms of actual quality, we're constantly assessing ourselves both with the administrative tasks of the surgical services from the top down in the operating room, all the way to reviewing data, reviewing outcomes, so that as an institution we can only keep getting better and not just focus on, say, individual merits. Ultimately, we're approachable. There's going to be a lot of questions, and we want people to understand that this is not a typical office where it's going to be impossible for you to get back in just to simply have your questions answered. We really pride ourselves on the education of patients. So you may not understand something the first go around, but we know that. My staff and I are going to help you truly understand the disease process, how to improve your health, things to focus on, and what to expect from surgery. This is something we know people are going to live and thrive and carry with them forever. So it's important for them to understand the surgical process as well as their diagnosis. The most important thing to know is that we're present and available to answer your questions, and certainly that we are going to be community surgeons first and foremost. We're truly local people, and it's our greatest care and interest to see everyone happy and healthy, and for us to keep on that tradition and to really provide for what's around in this region. And we really want to do what's best for the community.